When you picture the nation of Nepal, what actually comes to mind? It's probably those pristine, snow-capped peaks of the Himalayas, right? The crisp, high-altitude breezes, basically some of the most breathtaking, untouched landscapes on planet Earth. But there's a flip side. Beneath that postcard-perfect image, there's a much darker, much heavier reality about the air people are actually breathing right inside their own homes. And it's taking an absolutely devastating toll on their lungs. Welcome to today's Explainer. We're diving deep into chronic obstructive pulmonary disease, or COPD. It's a progressive lung disease that literally traps breath and steals lives.
So if I were to ask you right now, where in the world is the air taking the absolute heaviest toll on human lungs? I mean, you'd probably guess some heavily industrialized megacity, right? Or maybe a massive smog-filled urban sprawl. But we're actually going to challenge that assumption today. We're using Nepal as our primary case study to uncover this massive kind of hidden health crisis. And from there, we'll see exactly how the global medical community is fighting back with the brand new Gold 2026 guidelines.
Here's our roadmap for today. First, we'll look at the hidden epidemic in Nepal. Second, the risk factors driving COPD. Third, the Gold 2026 guidelines update. Fourth, rethinking exacerbations and treatment. Fifth, vaccines and emerging AI technologies. And finally, what this all means for you.
Section 1. The hidden epidemic in Nepal. A nation's hidden burden. Okay, let's dive into this.
Because the epidemiological data coming out of Nepal right now is honestly startling. While the rest of the world just sees these pristine mountains, inside a lot of these homes, thick smoke from daily cooking fires paints a totally different picture. A recent nationwide population-based study came out and revealed the consequence of this: an 11.7% prevalence of COPD among adults over 20. Think about that. Nearly 12 out of every 100 adults are living with this progressive, suffocating disease. But wait, that national average actually hides a pretty crazy geographic extreme.
When we look closer, these extreme regional disparities pop up. In Karnali province, which happens to be the least developed region, a terrifying 25.1% of the population is affected. That is 1 in 4 people. Then in the Kavre district, specifically for those over 50, it sits at 19.36%. But then over in Gandaki province, it's way lower, down at 6.0%. So why is the burden literally 4 times higher in Karnali than in Gandaki? Well, the answer lies in the daily reality of how these communities survive.
Section 2. The risk factors driving COPD, beyond just smoking.
Look, when we talk about COPD in the West, the conversation almost always defaults to cigarette smoking, right? But in places like rural Nepal, the air breathed while just making dinner is a massive, deadly driver. On the environmental side, using biomass fuel like indoor firewood cooking in these poorly ventilated homes, it basically creates this daily toxic exposure. Combine that with behavioral risks like heavy smoking, add in demographic realities like aging past 60, low BMI, and lower formal education, and then top it off with genetic vulnerabilities like an alpha-1 antitrypsin deficiency, it's the perfect storm. You've got aging, heavy smoking, and you're literally breathing in campfire smoke inside your kitchen every single day.
Section 3. The Gold 2026 guidelines update. The global medical response.
So, with a human crisis operating on this sheer scale, how does the global medical community even respond? Enter the newly updated Gold 2026 report. This document, well, it's the absolute gold standard for respiratory care globally. Backed by 330 new scientific references, this update provides a huge, comprehensive clinical modernization for how we diagnose, assess, and treat COPD moving forward.
Section 4. Rethinking exacerbations and treatment, acting faster to protect lungs. So, the crucial point is,
The most life-altering clinical update in the 2026 document fundamentally changes how we treat exacerbations. Those terrifying flare-ups where breathing just suddenly fails. The old clinical paradigm relied on this sort of wait-and-see approach. Doctors would often wait for multiple exacerbations before escalating medications. But the 2026 mandate shifts this completely. The new rule? Escalate pharmacological treatment after just 1 moderate exacerbation across gold categories A, B, and E. The clinical objective here is incredibly strict. Achieve a low disease activity state with 0 exacerbations, period.
And the clinical rationale for this shift makes a lot of sense. Emerging observational data proves that suffering even a single moderate or severe exacerbation before starting maintenance therapy significantly increases your risk of subsequent, even more severe events. Basically, a single flare-up is no longer just a bump in the road. It's a glaring clinical alarm demanding immediate escalation to preserve whatever lung function is left.
Section 5. Vaccines and Emerging AI Technologies. The New Frontier of Care.
Now, the 2026 guidelines also push COPD care way beyond just traditional bronchodilators and into the realm of modern prevention and technology. On the prevention side, protocols now fully integrate the new RSV vaccines right alongside updated influenza recommendations. This is huge because respiratory viruses are primary triggers for those exacerbations we just talked about. Furthermore, the report introduces a groundbreaking new Chapter 6. This officially integrates artificial intelligence into respiratory medicine. It outlines the principal AI models and establishes strict risk mitigation strategies for using them in clinical deployment. The future of care is absolutely data-driven.
Section 6. What this means for you. Translating clinical data to real life.
All right, so we've zoomed out to the mountains of Nepal, and we've dived deep into the clinical mandates of GOLD 2026. But what does this actually mean for you or a loved one? First off, recognize those everyday risks early. It's not just cigarettes. You've got to pay attention to indoor air quality, poor ventilation, and occupational hazards. Second, be your own clinical advocate. If you experience even one flare-up that requires medical attention, demand action. Talk to your doctor about the 2026 guidelines and escalating your treatment. And third, stay proactive with your RSV and flu vaccines.
Ultimately, as this explainer shows, the fight for lung health is a completely universal one. Whether we're talking about a rural kitchen in Karnali province or the most advanced research hospitals informing the GOLD 2026 report, the core message is exactly the same. Early action, identifying environmental risks, and refusing to accept exacerbations as normal are the absolute keys to breathing easier. So take a deep breath right now and ask yourself, what step can you take today to protect your lungs for tomorrow? Thank you so much for joining me, and keep learning.